Diseases of the oral cavity and esophagus in ruminants. Stomatitis can happen physically, chemically, from toxicosis, bacterial, viral causes, and fungal causes. The physical causes of stomatitis are sharp plants, tooth abnormalities, and foreign bodies. The chemical causes of stomatitis are irritant chemicals such as fertilizers, drugs such as chloral hydrates, and acidic and alkaline substances. For toxicosis causes, these include mercury and furazodoline. And for bacterial causes, these include Fusobacterium necrophorum and Actinobacillus ligniresi, which causes wooden tongue, as well as Actinomyces bovis, which causes problems with the gum and bone. The viral causes of stomatitis: in bovine we have foot and mouth disease, bovine viral diarrhea, bovine pupilar stomatitis, infectious bovine rhinitis, vesicular stomatitis, and rinderpest. And in sheep we also have foot and mouth disease, ORF, blue tongue, and pest to petty ruminants. And the fungal causes of stomatitis are Candida albicans. The types of stomatitis are catarrhal, such as simple. These include mild physical and chemical causes, as well as ulcerative, necrotic, purulent, membranous or pseudomembranous or crupus, as well as papular or vesicular. And the signs of stomatitis are fever, anorexia, depression, as well as halitosis, salivation, and dysphagia. For doing the diagnosis, look at the history and the typical morphological lesions and do lab diagnostics. In foot and mouth disease, you can see fever, drooling, and an endemic onset. And in rabies, you can see drooling and CNS signs. For the treatment, eliminate the cause. For diet, give good quality hay, molasses, and bran. Give fluid therapy if needed. And locally, you can give silver nitrate, borax, iodine, and mild oxidative disinfectants. You can also give vitamin A to increase epithelial resistance. And you can also give antibiotics locally or parenterally for 5 to 10 days. So for foot and mouth disease, we have lesions on the tongue. For bovine pupilar stomatitis, we can see papules around the mouth. For ORF, we can see crusts. For actinobacillus, we see a wooden tongue. And for actinomyces, we see lumpy jaw. For esophageal obstruction, it's caused by solid pieces of food such as apple, beet, potato, turnip, and cornstalk. When you do sedation and give general anesthesia, this decreases smooth muscle contraction as well. For the pathogenesis, obturation causes spasm and pain. This will also cause regurgitation, drooling, and bloat. And it can lead to esophagitis, perforation, or suffocation. For the signs, it can be peracute. It's an emergency. The animals will have restlessness, colic-like behavior, retching, salivation, regurgitation, and a mass in the jugular groove. You'll be able to see rapid bloat on the left side and subcutaneous emphysema in the case of an esophageal rupture. For the diagnosis, look at the feeding history and the signs. You can also do stomach or esophageal tubing doing endoscopy. For the treatment, give xylazine for sedation and scopolamine for spasmolytics, as well as NSAIDs such as metamizole, ketoprofen, carprofen, and meloxicam. And a foreign body removal can be done by hand, a rubber tube, oil, water, or surgery. And do trocherization if necessary. And for dysphagia, it can be caused by esophageal obstruction, or esophageal compression, which is caused by a tumor, or Halfont disease, which is vagal indigestion. It can be diagnosed with a pain probe and ruminal atony. Rabies can also cause dysphagia. You'll be able to see increased sensitivity, central nervous system signs, vocalization, and ascending limb paralysis, as well as negri bodies in the brain. And they can also get Oesphagus disease if they're in contact with pigs. They will have tachynoia and increased sensitivity and central nervous system signs. They can have the disease for 36 to 48 hours. And botulism also causes dysphagia. It's caused by Clostridium botulinum. And the signs are flaccid paralysis. And for cerebrocortical necrosis, it's caused by a vitamin B1 deficiency. And the signs are blindness and involuntary movements. And a brain abscess can be caused by bacterial mastitis, and you can see a hanging jaw.